Welcome to the Ostomy211 Pantry. We're so glad you're here. This video is to help orient you to the brands and some of the terms you might encounter here in the pantry that are used to describe ostomy bags, and also what those might look like. So the three brands are Hollister, Convatec, and Coloplast. Some of the terms you might run into are wafer. Come in all different shapes and sizes, but they're all wafers. This is what sticks to the patient's skin. A bag. Again, many different shapes and sizes. They all have the same job. They hold the content. There are different closures on these bags, including a Velcro closure that has this little Velcro strip and these tabs. You fold it over and then fold the little flaps onto the Velcro strip, and that's how your bag stays closed. There's also a clip, so you fold the bag over, place your little accessory clip, and it closes that way. There are bags for your ostomies, and they have a little spout. Just makes it a little bit easier to empty. And then there are closed bags that have no opening, and you would just take the whole thing off and throw it away. There are also one-piece and two-piece appliances. A one-piece has the wafer and the bag connected to each other, and the whole appliance goes on the patient. A two-piece, the bag and the wafer are separate. Two separate pieces that go together and go on the patient's skin. There are also different types of two pieces. Ones that snap together and ones that adhere together. So the snap together have a hard plastic ring on both the bag and the wafer, and the patient will physically hear them click together when put together. The other one, they adhere together, so there is an adhesive ring on the bag and a plastic rubber ring on the wafer, and they will stick together as one piece and go on the patient's body. Be aware while working in the pantry that there are also different sizes depending on the size of the patient's stoma. A 1 3/4 inch and a 2 1/4 inch are the most common. Be sure to ask your patients what they're using and just read the boxes to determine the size of the wafer. Also, if you pull a wafer out of a bag or a box and you're like, this does not look like a 1 3/4 inch wafer, we have this handy little tool that you can stick up there and measure it to determine its size. Going back to the wafers, there are a flat and a convex wafer. These are available in the kinds that snap together and adhere together. The convex wafer has a little dome to it, just to give the stoma some more room to poke into the bag. And the flat ones just stick right on the patient's skin. There's no shape to these at all. Thank you for watching the video, and there are photographs that are going to be scrolling through your screen after I'm done here, and it will just give you a review of what the brand boxes look like, what the bags are called, what those might look like. If you need any more help, don't hesitate to ask. Thanks for watching.